Hey guys, Dr. Will here from Miami Spine and Performance in Hollywood, Florida. Today we have Danny. It is actually his first adjustment, so we're really excited to have him. Danny was just telling me he's having a little bit of lower back pain, maybe due to work, maybe due to volleyball, and he's having some right-sided shoulder pain. So you guys know my soft tissue of choice is active release technique. So what I'm going to do with Danny today is we're going to help release some of the muscles in the shoulder. It feels to me like it's more of a muscular issue, just some tight muscles causing discomfort in the shoulder. And then we're going to give him his first full spine adjustment. So really excited about this. Any questions, Danny? Ready to go?
Yeah.
Awesome. Okay, so the first thing that I'm going to do with Danny is we're going to work on his shoulder rotation a little bit. A lot of time the rotator cuff gets jammed up and that can cause discomfort in the shoulder. So I'm just going to lift your arm up like this. And all I'm going to have you do, Danny, is when I say go, you're just going to slowly rotate up and then bring it back down. Okay? Ready? Go ahead and rotate. I'm just bringing all that tissue with me. Good. And again. This is a great way to kind of open up the shoulder capsule, help with that rotation for serving and spiking during volleyball. Good. Keep going, Danny. I'm just going to switch my direction. So this one's going to be a little bit tighter. Again, I'm just kind of grabbing all the tissue on top and letting his shoulder do what it wants to do. Good. Okay, so now from here, you're just going to do the opposite. So you're going to start at like this field goal position, and you're going to rotate to about there, right when your shoulder stops, okay?
Okay.
Ready, and go. So I'm just following him down. Good. And this is a motion that's usually really, really jammed up in people, is this internal rotation. And that's due to that tight rotator cuff. So this one's going to feel a little bit tight. Good. 2 more. Doing okay, Danny?
Yeah.
Last one. Good. Now we're going to release the posterior shoulder. So what I'm going to have you do, Danny, is you're just going to do like a bench pressing motion, kind of like that. And I'm just going to follow you through, okay? So go ahead, reach. It might be a little bit sore. So right now I'm on the infraspinatus for those anatomy nerds out there. Good. Now I'll come up to the rear delt. I'm just going to release as he pushes. Awesome. Any soreness back there, Danny?
A little bit.
A little bit. Good. Relax. Okay, so now we kind of got the shoulder warmed up. So Danny, I'm going to have you go face up now. So this first area I'm adjusting, for those of you that follow my content, the upper back tends to get rounded from sitting in the car, sitting at the desk, poor posture and things like that. So what this adjustment is going to do for Danny is it's going to help open him up. So he's going to be able to take deeper breaths. He's going to stand a little bit taller, might gain half an inch or so. So we'll see. I'll roll you this way. And we got a spot right here. I'm just going to roll you back. Nice. And we got one a little bit higher. Awesome. Feel that one?
Yeah. Got both of them.
Yeah, so he's kind of tight all the way up through here. So whenever you scoot your bottom hip towards me, this way. There we go. Good. So same thing as before, you're just going to feel a little bit of pressure and then a lower release. Take a big breath in. Breathe out. Perfect. Nice and easy. Other side. Sometimes when it's super locked up and tight and compressed, all it takes is just a little pressure and then it releases. So for me, it makes it nice and easy. Hips towards me. Okay, pull this one up. Does your back feel comfortable in this position?
Yeah.
Okay. So we're going to check the other side now. Usually one side's a bit tighter than the other, so this is not as bad as the other side. Take a breath in. Breathe out. Awesome. Face up. Okay. So we're going to go in and adjust these areas. So we're just going to do a little adjustment. It's going to help Danny move a little bit better and relieve some of the tension up in the neck. Okay. I'm just going to take you this way. Just let everything go. Awesome. And same thing this way, nice and easy. Awesome. How'd that feel?
Awesome.
All right, now we're going to release the shoulder, and Danny will be good to go. But that's, again, kind of a normal full spine adjustment. It's It's nothing crazy. It doesn't take a lot of force, especially if it's a first timer, somebody who's young and healthy and just has a little bit of compression in the spine. It's very easy to release that tension, and usually the benefits and adjustment can last anywhere from 2 weeks, 6 weeks, 8 weeks, something like that. So now we're going to work on the pec here a little bit and the lat as well. So I'm going to just have you go here, and we're just going to stretch it up this way. Oh yeah, that shoulder's pretty tight actually. You lift weights also?
No.
Just volleyball mostly for exercise?
Yeah. We've been doing paddleboarding lately and stuff too, so.
Oh, there you go. And do you use like your arms a lot in your profession?
Yeah, as a maintenance, I usually have my arms above my head a lot, replacing lights and stuff like that.
Yeah. So usually something with the profession is usually either the sport or the profession. So Danny was just saying for his job he has to be reaching overhead and things like that, so that'll cause some tightness through the shoulder. So all we're doing here is we're just kind of stretching out the pec, stretching out the lat. When these muscles get tight, it's going to be more difficult for him to reach overhead. So this is going to make him more comfortable at work, and it'll make his shoulder a little bit happier so he can go paddleboarding with his wife on the weekend. Good. I'll just do a little pull here. All right, that's it, guys. So that's an abbreviated treatment for Danny. Again, first time adjustment, a little bit of shoulder pain. So typically what I would do with the patient, especially in Danny's case, we'd also add some decompression, maybe some soft tissue work for the low back. Then I would send him home with some exercises for the shoulder. So thank you guys for watching. Tune in next time. We'll have another patient for you guys. Thanks.